Distinguished guests, honorable speakers, ladies and gentlemen, good afternoon. I'm pleased to welcome you on the third plenary session about urban governance and equity-oriented policies. The session will be chaired by Professor Markus Grant. He is an advisor to the World Health Organization Healthy Cities Programme, Director of Supporting Healthier Inclusive Urban Environments, Bristol Health Partners in the United Kingdom, and Editor-in-Chief of Cities of Health. Please give a warm welcome to Professor Grant.
Oh, thank you.
On behalf of organizer, I would like to extend warm welcome to our distinguished panelists. Professor Jason Carbone, Associate Professor in the Department of City and Regional Planning at the School of Public Health, University of California, Berkeley. Please give a warm welcome to Professor Jason Carbone. Mr. David Grossman, Director of Global Programs at the International City Management Association in United States. Please give a warm welcome to Mr. David Grossman. Next, Professor Susan Parnell, Professor of Urban Geography and co-founder of the African Center for Cities at the University of Capetown, South Africa. Please give a warm welcome to Professor Susan Parnell. And finally, Dr. Ricardo Baptista Leite, City Councillor of Cascais Municipality in Portugal and member of the Portuguese Parliament. Please give a warm welcome to Dr. Baptista Leite. I hand over the plenary to Professor Markus Grant and enjoy the session.
Thank you, and welcome to this plenary session, which is titled Urban Governance and Equity-Orientated Policies. And we all are wanting desperately to stick to time so that it gives you a lot of time for discussion and challenging the panel and opening things out. So, I'm asking for everyone's cooperation in that, but also Paola will hold up a little indicator to you. You can always dip in with something you've forgotten later on the questions. So what we're here to do, I think, is unpack effective local government, but also models that work in terms of governance. And what do we mean in terms of governance? What are the challenges for successful, inclusive governance? And you're going to hear messages here about involving local people and communities in generating new ways of linking research and action. We're going to hear about the vital role of local government. We're going to hear about the quality of dialogue needed to transcend the boundaries that separate us for urban health. And finally, how acting locally is also a vital component, obviously, of then having global impact. So, without me saying any more, let's go straight to the panel. Jason,
okay.
Presentation, thank you.
Great, thank you. Okay, good afternoon, everyone. I am going to try to set a little bit of the context of health equity and urban governance and what we mean by that, and hopefully be a little provocative and maybe keep you awake if you hadn't had enough espresso. So making a few arguments about how we can rethink what is our approach to urban health equity. It's not just about research, but how we engage different communities, setting new agendas, influencing and implementing policy, evaluating the impacts, and returning back to those decisions. And I'm going to mostly focus on three concrete examples from my own work with partnerships in North America, in Latin America, and in Nairobi in Kenya. So why governance for health equity? Why are you even in this session, or why did we put this session together? And as Marcus just said, that governance is not just government. It is government, but in my definition, it's also the norms, routines, the practices that set the agenda. How does an issue get on the local government or governance agenda? Who's involved? What's the evidence that we use? Who gets constituted as an expert? And fundamentally, we must think about governance and equity as related because it's about the distribution of power. Who has power to shape decisions and ultimately, hopefully, to improve lives? So let me jump into the three examples. First, in the San Francisco Bay Area in California, I'm not sure how this works. And I'm going to be talking about a community on the top left for you, Richmond, California. And this is maps that you've seen before, hopefully, and have been disturbed by the differences, very close proximity, a few kilometers away of life expectancy, in this case, of living just a few kilometers away. And in Richmond, one of the most violent cities in the United States at one point when we first started working, and one of the most violent in the world. Also dealing with a lot of environmental stressors, pollution, and a big problem with the relationship between the traumatic effects of gun violence and health outcomes, particularly for young people. So how did we address that? Well, we started not with research of experts, but by engaging community residents in multiple planning dialogues and venues to ask them what would they want as a healthy and vibrant community, and had multiple workshops like you see here. And three specific frameworks for governance came out of those workshops. One is focusing on what we call more upstream, and in public health, we're often talking about outcomes and health behaviors on your right-hand side. And what we came out of those conversations with community residents was to focus on the upstream living conditions, inequalities, and social inequalities, which were influenced by policy, which again emphasized the importance of governance for us. The second important thing was about defining health equity. And here I'm showing equality and equity, giving the least off or the most vulnerable a little boost up. But also what we heard from community residents was not just addressing, promoting health equity, but really dismantling those structural inequalities, those systems that create these inequities in the first place. How could we do that also through these governance strategies? And a definition of health equity that came out of our process. And the third was, again, that there were multiple stressors on people's lives. And the idea of toxic stress is now well documented in much of the medical literature. A set of social and environmental conditions adversely impacting people's bodies. And that was the reality in Richmond. It wasn't just air pollution. It wasn't just asthma as an outcome, for example. And what this idea suggests is that a stressful event is okay for you. You get that release of a hormone and you get that fight or flight mechanism, but chronic stress is toxic. Your hormonal system doesn't turn off. It doesn't shut down that release. And what it leads to is a lot of the chronic illnesses that we're looking at in this conference. And also vulnerability to infectious diseases. So these three frameworks really drove our interventions, and those interventions just quickly were, how do we have an integrated approach to land use planning? So we brought health and a health equity framework into the land use plan, and eventually that led to the first health and all policies law or ordinance in the United States in a city. It has multiple dimensions around these ideas of health equity that came out of this community process. Let me just highlight a few of those. One is focusing on rebuilding and re-energizing public spaces, parks, community spaces, not for people, but residents doing it, getting paid to do it, and getting paid to operate the park and the public space as their own. Youth were key participants in all of this, and they continue to be real leaders, engaging young people in the process and in the implementation and evaluation of a lot of this work. Economic opportunity, upgrading housing, improving housing was done through a job training program that the city and NGO started together. And I just want to overemphasize the importance of addressing gun violence. And what we did was to create a new office within local government of peacemaking. Along with the transportation department, along with parks, along with housing, was a peacemaking entity, and it was called the Office of Neighborhood Safety. And it hired former criminals. And this was pretty radical to convince the mayor that that was okay to have city employees that were formerly incarcerated. But it was critical that these were the folks who could go out and connect with young people on the streets who were already committing gun violence. And this is the program. One of the key pieces of this program was to engage people one-on-one at the street level, but also bring them into a fellowship that then gave them economic incentives to get the mentoring, support, life mapping, opportunities for jobs that kept them engaged in this fellowship and off the street. These are some of the results since this program over the last 6 or so years of reducing gun violence. 94% of our fellows, over 92, are still around, and significant community impacts. Let me jump to 2 quick examples. I have 2 minutes left. Of course, the city that we most recognize, or many of us in the urban recognize as a model city for local governance, is Medellin in Colombia, with winning many awards, and also reducing from the most violent city in the world to one that now is not even in the top 50. How did they do that? Well, they did that through many things that you may already know about, of public transport, of improving public space and access, opening up the city, particularly to the poor and low-income communities, and really in an ongoing way engaging residents to create, say, participatory budgeting to prioritize what they want in their community and targeting some of the most beautiful investments for the poorest communities. Final example, and I have 30 seconds to talk about this, is in Nairobi, Kenya. Again, another partnership of NGOs and local government, highlighting what are the hazards and risks in a community and reorienting the decision-making process in a community called Mukuru that is under multiple stressors and some of the worst health outcomes. You heard Alex at the previous plenary talk about some of those health outcomes in Nairobi slums. What we've been doing is engaging residents to collect their own data through a process called micro-savings and use that to document the risks that they have, and recently, including, this is an example of air pollution risk, mapping their toilet and water access. This is an example of a toilet and self-related health, and moving that into a campaign, an advocacy campaign led by residents, particularly women, who are most burdened, disproportionately burdened by poor infrastructure, by pollution, and environmental risks. And that's led to the first declaration in Kenya of a special planning area, SPA, most recently, just a few months ago, using the information and the data to justify this new designation, which mandates a new planning process, an engaged process of community residents, NGOs, local government, to replan and define what they want in that community and integrate it into the broader fabric of the city. So just to wrap up, what is governance and why ought we be paying attention to it for health equity? How is it so critical? It values community expertise and not just research about and on communities, but with them. Policy change is critical, moving from our small individual boutique projects into policies that really change those structural factors that are driving inequalities in cities. And we need to focus simultaneously, not just on built environments and improving places, but also engaging and giving people the supports they need, simultaneously addressing those multiple toxic stressors. And we need to act with incomplete and often unsatisfactory data, and not wait till we have complete data. The crisis of health inequalities is too acute and too important, but we must learn as we go, with residents, not just experts acting alone. Thank you.
No, just Jason, just stay there a moment, Jason. David, yeah. Sorry to have rushed you maybe a bit there, but we want to stick to time. But is there anything you felt you glossed over and would want to just emphasise there in having to go through that quite rapidly? Anything you felt you missed out?
No, maybe just through the Q&A.
Some questions. So, have you got the roving mics? People with the roving microphones? Can I see? Hold them up. We got any microphones? Oh, just getting them. So, yeah, because presenters are sticking to time, which is great, we've got time for a little Q&A for each. Maybe just points where you want a bit more information, something expanded, not something to open up a big discussion. We'll have that later. So if you put your hands up so I can see you very clearly, and a couple of questions here to Jason. Can I see anyone? Yeah, this woman in the middle row there. If you just say your name and affiliation or where you're from before your question. Thank you.
Hello, my name is Jieling. I'm from the University of Lisbon. I'm a PhD candidate. So my question is, thank you for the presentation. I think the case study of Medellin and Nairobi is really inspiring. I want to ask, because you talk about the place, the people, and the livelihood, and how the socioeconomic interaction with health challenges, it all looks really nice. And I want to ask, you chose this case studies, is it because these cities have potentially a kind of already recognized, a well-recognized need for intervention in their health challenges? What about places in let's say in South Asia, in many of these slums in I don't know, in Thailand, in Vietnam, and also what about the financial aspect? How is it being elaborated in your projects, and how could it potentially be facilitated in areas with less well-recognized images with such needs? Thank you.
Did you catch that?
Okay, if I understood the question, how does different communities, not these ones, can they do the same thing, mobilize, and what are the financial, how does this happen in low-resourced settings? These, particularly in Richmond and Nairobi, very low-resource settings. I think almost every community has some organization, some people mobilize, particularly when they're under health stressors or environmental stressors. I think we need to get inside and work with and meet community residents to see what are their concerns, not to assume that they just need our advice necessarily, or that they don't know what the hazards that they face. And that's, I would say, in many places, not all, but almost every place that I've been around the world. Secondly, a lot of these interventions were zero cost in terms of mobilizing residents, and there are great examples that I can give you in Asia and Thailand, like you mentioned, Vietnam as well, with very low costs, community change, all of these things in terms of the learn by doing strategy, starting with very small but concrete projects that people can really see change, even though they're incremental, and to build up from there. It's not about massive city plans, then top-down implemented. So I think that's a way to do it in very low-resourced places.
Thank you. Have we got another question to Jason? We'll just take one more. Up, yes, at the back here. Can you just speak quite slowly? It's quite boomy and echoey. It's difficult for us to hear. So pose your question quite slowly so we can hear down here.
All right. My name is Remy Setupin from UN Habitat in Nairobi. My question is about attribution and contribution. I just want to, if you have time, during the panel, to discuss a bit how you can clearly identify how the work, your contribution in achieving what you alluded to, like the special plan area or other legislation, how your work actually contributed to that, or because I had the sense that you were saying your work led to some of these things. So I just want to distinguish between attribution, contribution to some of the governance arrangement or regulatory frameworks that emerge throughout that process. I don't know if that's clear enough.
Thank you. Did you?
Okay, so I think it was about attribution of work. How did the work that we did contribute to some of these changes of governance and strategy? Well, if Marcus would have given me more time, I could have explained in more detail, but these were very integrated partnerships of action research with community residents, in the case of Nairobi, with supportive NGOs, also occasionally with Nairobi County involved. And so it was over a series of 2 or 3 years of collecting data, of advocacy campaigns, of mobilizing residents, and using legal levers, particularly in this case, the opportunity to create a special planning area, which is part of the new constitution, newish constitution in Kenya, as you might know, and the Land Act, to create that for an informal settlement, which then mandates a 2-year planning process, stops demolitions and displacement and other things. And so that's what's going on now. So I'm not taking full credit for any of this. It's part of a action research partnership that really contributed the evidence base, new knowledge, new sets of experts to put pressure on local government, but also work with them. This notion of co-producing kind of governance change is how we got some of the outcomes that I explained.
Thank you. Thank you. Let's move to our next presentation. Okay, David.
Thank you. So good afternoon, everyone, and thank you to ISUH for inviting ICMA to speak at this event. This is my third ICUH event conference that I've attended to, and I'm a fan of the group and a repeat customer, as you can see. I am not an academician. I'm not a researcher. I'm not a politician, and I'm not a health sector professional. But what I am doing is representing a very important group of professionals without whose work and participation we would not achieve our shared vision of thriving and healthy communities. And these are the professional city managers who run the day-to-day operations of our cities. And if you're not familiar with the role of the city manager, I'll explain a little bit what they're about. So ICMA, we're a professional association for city managers and other local government officials, over 100 years old. We now number more than 11,000 city and county managers, and we provide professional development services, networking, and technical assistance to cities in the US and around the world. We have about 700 international members, and I'll explain more about that. We provide consulting services in more than 70 countries around the world. We have 3 regional offices in Ahmedabad, in India, in Beijing, in Guadalajara, Mexico, and we're opening up an office in Europe, in Slovakia. We have 25 plus of international affiliates, which are municipal associations in other countries. So we very much have an international profile, and we're a platform for information sharing, lessons learned, best practices in cities. We provide technical assistance. We do significant amounts of survey research among our members, our international affiliates, and others, and we are the second largest producer of subnational level data next to the federal government in the United States. We have many academic members who join ICMA for our data. Based on our survey research and best practices, we develop content, webinars, etc., and we provide training and education throughout the whole life cycle of the careers of our members, from new entry and onwards. Our flagship program is called CityLinks, and for 25 years we've been partnering cities around the world to exchange best practices. Local government officials go back and forth and roll up their sleeves and look at common problems and help each other to find best solutions. So health in the new urban agenda. When I first attended in Dhaka in 2015, the ISUH conference, a light bulb went off for me because I met a whole group of health practitioners who really understood the urban context and the important role of local government in setting the framework for their work. So I went back and ICMA developed a white paper, which I'll talk a little bit about integrating health into all aspects of local government management. That was followed by the WHO and UN Habitat paper looking at the SDGs, and then came out the World Health Organization paper on health as the pulse of the new urban agenda. So ICMA is really riding this wave of integrating health and urbanization. I want to pause here because there was yet another paper looking at financing for impact and covering the health sector, and that blue line, most of the funding to fund health services in cities is coming from cities' own source revenues. The bottom lines are external funds from foreign aid or foreign investment. The next highest line is domestic private sector funds. So the message here is that cities need to have strong enough economies to generate own source revenues to finance health services, and they need to leverage local domestic private sector funds to support that effort. It's not going to come significantly from foreign aid or from foreign investment. So the health of cities is very important to sustain these services. So we at ICMA, we are developing an integration strategy for like whole of government to address health. We're doing significant research, including the white paper and from our domestic projects in the US, and several of our international projects also are developing best practices. This is our white paper. It looks at new trends in the historical public health roles of public safety, water and sanitation, waste management. These are the traditional roles, but even those functions are evolving to meet modern health needs. But more so, the paper is focused on the new role of local government, and as has been discussed, and as you all understand, all of these different departments of local government have direct impacts on the health of residents, and integrating health in all these policies is a critical and new task at this time. And we have some excellent examples of cities in the US and internationally that are applying this integrating strategy. We have several projects on environmental justice in the US funded by federal agencies and foundations. We work for the Environmental Protection Agency managing their Brownfields Conference, which is a conference that draws 5,000-6,000 people, including international people, to address soil contamination, soil remediation in cities. We've done a choice neighborhood report for the Department of Housing and Urban Development looking at low-income housing, which is, as you know, a determinant of health, and other research on active living design, community walkability, which I don't have time to get into the details of them. Robert Wood Johnson Foundation has funded a number of these activities. We're all about capacity building of local government officials, bringing to their attention best practices and approaches, and giving them a network of colleagues with whom to share experiences. I don't have time for our international projects, unfortunately. This is a medical waste project working with hospitals. We started with a few hospitals. It's a very successful project where the private sector has taken it over. It's incineration and a lot of best practices. We partnered city in the U.S. with Amman and in this case, universities. In Shimla, India, Boulder, Colorado, 2 mountain cities addressing climate adaptation and water pollution. The source of water in the Himalayas is being severely threatened by climate change, by urbanization, pesticides, deforestation, etc. And we had city managers working together to look at those issues. In Georgia and Eastern Europe, we have a solid waste management project that goes from collections all the way to recycling. We're giving small grants to small private sector companies to encourage the recycling industry, and a big public awareness campaign. So solid waste management from soup to nuts, looking at unregulated landfills and dump sites in small towns, and developing regulations on the management of appropriate management of landfills with attention to greenhouse gas emissions, etc. So moving forward, this is our research focus on doing health impact assessments, sharing services, not only health administrative services, but also frontline physicians between jurisdictions, crime prevention, as was mentioned by Jason, the opiate epidemic, which is a huge problem in the U.S., food deserts, climate adaptation. We're doing a lot of land use planning, inclusive land use planning in the Dominican Republic and in the Philippines, where cities are really threatened by sea level rise and storms. Focusing on employment, especially youth employment. We have a large project in Jordan where this is a serious issue. And of course, the built environment. I just want to end on this last project, this City Health Dashboard. We are teaming, this is also Robert Wood Johnson Foundation funded project. We're teaming with New York University. And I'll just take a minute here because this is exciting, and you may relate to this. This is we're a founding member of the National Resource Network, which is a large group of distressed communities in the United States where we have provided technical assistance in local economic development and other needs. And from this group, we are working with several pilot cities to develop a dashboard, which is a web-based resource that allows immediate lookup of health-related measures at the city level with census-tract level data when available. And it provides apples-to-apples comparison from one city to another. And the goal is to assist municipal officials, community leaders, and other local policy actors to drive health improvements by presenting the evidence needed to understand population health and its actionable determinants in their cities, and to facilitate comparison with other cities. So the idea is by the end of the project, which I think is a 2-year project, we will implement this in every city in the United States with a population greater than 70,000. And basically, the metrics, there are 26 metrics in 5 different categories, which are health outcomes, health behavior, clinical care, social and economic factors, and the physical environment. Thank you.
Thank you. I'm sure that City Health Dashboard will be something that a lot of people want to hear more about. So can we have a couple of questions for David here? Raise your hand if you have a question. Particularly sort of something where he could have expanded a bit more, or you want to drill down and hear just a little bit more. We okay there? Okay. So let's move on. Susan, thank you.
Thank you. My little thing says it's got a low battery. So you're going to have to listen, and it's not a very intimate exchange here, so I hope that you are able to work with me on that. Partly because what I want us to do is to think about some of our collective responsibilities over the immediate future as we begin to think about this relatively new domain of work of urban health in the context of a very, very rapidly changing policy environment. I'm not driving this very well. There you go. No? There you go. Just to refresh your minds, and if you are young, you may not even remember this, but we really have very quickly come a very long way in the shift of expectations of what we are trying to do. And to remind you, the MDGs were very explicit about health, much less explicit about some of the urban questions, and really only had a focus on the global south. The expectations of the new global policy environment for governance, within which we're wanting to talk about questions of urban health, are very, very different. We've got an explicit focus on cities, we've got an explicit focus on poverty as well as inequality, we've got a clear commitment to talk about financial questions and institutional questions. There is a conscious shift away from some of the idea of siloed thinking, and there's a very overt expectation that we're going to be able to link social, economic, and environmental concerns. Okay? So the expectations of what we collectively, practitioners, academics, policymakers, communities, are able to achieve is greater than it's ever been. And we were part, as scientists, and I'm speaking as a scientist here, we were part of making that happen. Okay? It's really exciting, I think. The focus for the new urban environmental health, the new focus on the urban, came very clearly out of a range of scientific interventions. Some of them from climate scientists, biodiversity scientists, some of the health programs that's sponsoring this very conference were absolutely fundamental to making the interventions which give us this new culture, this new value system, that paradigm shift of what we are expecting to achieve. And so we've got a whole lot of new policy statements that come out of that process, the SDGs and the new urban agenda being our concern specifically here today. We weren't on our own, we didn't do everything ourselves, and I think what we were able to ride was a more general excitement about cities. Although some of you will have seen, I don't know if you noticed that Richard Florida has just brought out a new book in which he apologizes for his version of the creative city and the way that that has led to gentrification. But certainly he and many others were part of this idea that cities were the economic vanguard, that they were going to lead, that they were going to change, that they were going to revitalize, that smart cities were the way ahead, that you could reinvest in cities as part of a drive for a national economic boom. So economists really happy. Civil society also really keen on the idea of a city focus to our everyday practice, to our everyday understanding of governance. And that's partly because the kinds of organizations that Jason was talking about, of SDI, having, and some of the community groups, having made really successful interventions to improve participation in local government processes, in the management of cities in particular kinds of ways. The built environment professions, some of which are municipal managers, but some of which are engineers and all of those other kinds of people, were also, this is great. Hovarab, any number of the big engineering companies, really happy about the resurgence of cities. True of IBM, true of Google, true of any number of people. So there's a global kind of consensus that cities are good, and we're riding that to some extent. The tricky part is not just moving this thing along. The tricky part. Am I being mad? Help me. No? I really am. Okay, the tricky part about this is that actually what we are doing is that, in fact, we haven't got such a clear consensus. And now that it comes to the question of assembling and making decisions and getting a strategic vision and beginning to put in place implementation, what we begin to discover is, in fact, that there is no consensus. And the difficulty is that whether you, and we'll see this when you talk to people from across the room, whether you come out of an urban contextual background or set of professional ideas and formative training, or whether you come out of a health practice, or whether you come out of a community-based intervention or a local government-based intervention, your understanding of the way that these key issues come together in the urban context is not the same. And so the 2030 agenda doesn't mean the same thing to any one of us in particular kinds of ways. And so if you listen to nothing else of what I'm going to say, listen to the next couple of points. It seems to me, colleagues, that what we are at is a moment when we need to be honest about the fact that what we actually have to deal with are a series of complexities where we have, in fact, incommensurable ideas, incommensurable practices, and potentially incommensurate scales. Certainly, we have incommensurate differences of interests. In other words, what we have here is a whole lot of people who are interested in health, who are interested in the city, who are interested in governing, but not necessarily in the same way, or for the same interests, or over the same timescales. That temporal question alone, forget about any ideological differences, forget about any vested interests which are different, mean that there really are some very difficult decisions to be made. Do you seek to improve health outcomes now? Do you seek to improve health outcomes for the next generation? And that affects very basic kinds of questions. Do you put your money into healthcare provision now, or do you put it into water and sanitation? Whose budget does it come out of? That, plus the fact that what we have is really inadequate knowledge about the way that the complex systems which come together in a city actually operate, makes it extremely difficult to know how best to intervene to ensure the improvement in health outcomes. Whether we're looking at nitrogen flows, carbon flows, or pathogens, will give us a very different take on what it is important to do in the city. And because our budgets and our professional capacities and our modes of intervention, in fact, even our modes of engaging with communities, tend to be structured around our particular sectors, it's actually very difficult for us to come together. And so, it seems to me that as researchers, particularly researchers who are willing to, happy to, and seek to engage professional practice, there are a number of different challenges for us. There are three there. The first seems to me, I think, to be really largely the domain of scientists. It is our responsibility to lay bare some of those contradictions and tensions and dissonances, rather than simply to encourage and to affirm a naive interdisciplinarity, and rather to seek the kind of knowledge that actually realistically can begin to inform policy of the kind that will take us to the SDGs. That means that together with people who are engaged in the operational concerns, we need a much better understanding of causality. We need to understand what are catalytic interventions. We have to understand much better the kinds of interactions. Some of the sessions we had this morning, the interactions between transportation and health service provision, for example, and health outcomes. What, in fact, is it that we do that will ensure that we spend our money wisely, that we train our future professionals appropriately, and on the basis of that, that we are able to make the kinds of priorities and sequence the sorts of interventions that we make based on evidence. In other words, colleagues, what I'm suggesting is that we have to reframe. Somebody talked in the last session about finding a new paradigm. And it seems to me that that is imperative. And it's not easy. And I'm taking one example here from the African context within which I work. And of course, that is going to be the litmus test of where we work. And the yellow, it's in the slide to come. And I give you one reason why that institutional application of the knowledge that we require to do things differently is so difficult. What we've entered into is a domain which acknowledges that the governance arrangements are multi-scalar, they're multi-sector, they are different in temporality. And so all the slide shows you in those three maps is that we have very different paradigms of who is important in this regard. So on the right, you have the Mayors Rule the World book, the idea that cities are dominant, cities should do absolutely everything, should be the central and the primary actor. In the middle, you have a photograph taken from Nairobi. Some of you will recognize from UN Habitat premises. The idea that the global scale is important. Actually, it's the multinational corporations, the funding organizations, the big finance institutions. That's who we have to work with if we're going to make the kinds of interventions. What WHO says is really fundamental to shaping health policy. But in fact, when you go to the last slide, and I don't know if you recognize it, anybody know what it is? It's not upside down. No, I can see somebody trying to turn it around. It's the right way up, depends where you live. It's a map, it's an old one, because I can't find a new one, of the old boundaries of chieftaincies. And if you work anywhere in small settlements in Africa, what you begin to discover is that the local dynamics are often ones that are uncharted, unregulated, uncodified, and are run, in fact, by chiefs. Now, whether you like that or not, whether you think that's problematic or not, the realities of urban health provision, of strategic decision-making, of the knowledge that we require to make the kinds of inclusive interventions hinge on understanding all of that across all of our different kinds of domains. And so I hope it's in that spirit that we are here to listen to each other, to think critically about what a more inclusive governance requires of us in the way going forward. Thanks.
Thank you. Thank you. Thank you, Susan. Some questions to Susan? Some bits that need further explanation or to drill down into some of that? Come on, don't be shy. Put your hand up if you've got a question. Okay. There is a question. Yes. Thank you. Yeah. A mic will come. Just state your name and where you're from. Thank you. Yeah.
Thank you. Jeannie Birch from the University of Pennsylvania. So you've thrown out a challenge. How do you expect us to respond to it?
With caution.
Come on, more than that.
No, I think for me what is really interesting is to be aware that what we set in motion, probably over the next 2 or 3 years, is likely to solidify into an everyday practice of thinking about cities, about thinking about priorities that will get embedded. So, and we want to make sure that we've thought about that carefully. So I'll give you an example. The New Urban Agenda talks extensively about using national urban policies as an instrument to draw together these competing, overlapping, potentially conflicting interventions and aspirations. And that's almost certainly appropriate. But how we do that will turn out to be very significant, and how we imagine what needs to go into that will be important. For me, an analogy is if you go back to the early 20th century and you think about the codification that happened around building codes or the Slums Act, which were responses to equivalent complex moments and moments of massive transition. But it does seem to me that what we are sitting with right now is a shift in values and a shift in actors and a shift in technologies of how we manage cities, which undoubtedly is going to change practice. And it seems to me to be a moment for collective wisdom and self-conscious reflection on what we perhaps inadvertently set up as the normative base for managing the urban future. I don't know if that helps.
Thank you. Good question and excellent answer as well. Is there we've got time for one more question to Susan. Yeah, thank you.
Supposing you turned everything upside down.
Could you just say who you are and where you're from?
Fred Kent, and I'm with Project for Public Spaces.
Thank you.
So we do something called placemaking, which means you have to turn everything upside down and focus on place. And then if government is focused on place, the disciplines have to line up. And if you focus on 10 places on a street or 10 places in a city, the community becomes the expert, is the expert. And how do they look at and behave and challenge and achieve their future as a place? You have something very different than what we've been doing. It gets very complex, very dynamic, very engaging, very exciting, very inclusive. Equity and economic development all follow, and it means that we have to change everything. What do you think of that?
So I'm a geographer, and the question of scale.
I study geography as well.
Well, the question of scale is a really important one, and I mean I think it is one that we use differentially. So typically health professionals focus either on the individual or on the population as a whole, and they don't have a particularly spatial sense. And we had a lovely session this morning talking about the kinds of new research methodologies that are able to bring together the kind of geospatial and the more statistical forms of modeling to begin to understand some of those dynamics. I mean, I think there will always be a tension. Within the social sciences over the last decade, the tendency has been to focus very closely on the local, livelihoods, communities. It does seem to me that what we have at the moment is a tendency to push back to say that the global scale is more important, with this kind of recognition that there are other places of intervention. And I think, to go back to Jeannie's question, it's that issue of where are going to be the hubs through which we connect the individual to the neighborhood, to the city, to the national, to the global, and making sure that we get the governance arrangements and lines of accountability right at those scales. That will be really, really important. And there are new ways of doing that, so we do have to think out of the box.
So we have a partnership with Brookings and Bruce Katz on Placemaking and Innovation, a Center for Placemaking and Innovation, and we're trying to figure that out and look at that. So it's a great discussion. Thank you.
Thank you. Thank you. Ricardo, we have your presentation. Can
you turn these off?
Well, good afternoon, and thank you for the invitation. I'd like to greet Professor Paulo Santana, who got me here, and also the chair and my colleagues in this panel. It's a great honor to be in Coimbra. I have to say that this is a very challenging time for all politicians in Portugal, where we have local elections next Sunday, and my wife is actually running for president of local parliament in this city. I'm not going to campaign, but if you do live here, vote for her, please. But I have to say that this is the second best place to organize this conference. The best place would be my city, and that's Cascais, 20 kilometers off of Lisbon, by the sea. You're all invited. And I'm going to try to reflect some of our experiences back there to share some of the things we've been doing precisely in the field of urban health. So Cascais, here you can see a satellite image. You can see we're surrounded by sea. 2/3 of our territory are a national park, so it's completely reserved area. and it's 92 square kilometers with a 200,000 population, with a highway and a train that connects us directly to Lisbon in 20 minutes, and of course to Lisbon International Airport. And what is curious is you can see that line in the middle, A5, that's the main highway that connects Cascais to Lisbon, and it has actually divided the municipality. To be honest, most people that listen about Cascais, it's the posh area where Hello magazine would go, you know, see the celebrities and all that, and CEOs and ambassadors love to live there. But on the north side of the highway, you have a completely different area. And we have tremendous inequalities that many times are not talked about. And we tried to focus on that for many years now. The city, of course, the Agenda 21 was a very important step towards a sustainable approach to management at the local level, with important projects in the environmental field, but also, for example, participatory budgets. So promoting citizenship and democracy. And we actually now have the most participated public budget in Europe right now, and more people vote in that process than they actually vote on local elections. So when it counts, people vote. And MDGs was mentioned here. I'm not going to spend much time, but that also played an important role globally. And then in 2015, the United Nations General Assembly passed what then became the Sustainable Development Goals after the +20 Rio conference. And that was an important step. We had seen with MDGs, it wasn't perfect, but it really did help us push forward. Now we're looking at these SDGs that are helping us look globally, and not just at a certain part of the world, and not just looking at very specific, narrow goals, but widening also those goals. And that's how these 17 came about. And I took office in 2015, and so it was very convenient. And I said, this is the great opportunity for the city to continue to push forward. And of course, Antonio Guterres is our Secretary General, the UN. We are very proud of that as Portuguese citizens. And he was very clear on the need for a global response and to go from concept to implementation. We have heard from every speech here today that that is one of the major challenges. And so we started to think at the city level, what can we do to go from this amazing concept into true implementation? Which means that we had to rethink the way we work as a local government. And so we developed a project that we called Cascais 2030. We launched it last week, which integrates SDGs at the core of our local governance system. And what we did was, every city councillor, when they present a proposal to the board of the city, they actually have to fill out a checklist for each proposal. And they have to say which or one or more SDGs they're aiming to go for with that proposal, and if they have any specific comments. With this, we're able not only to get a clear idea of how these proposals are contributing to these SDGs, but actually we're keeping it high on people's agenda on a weekly basis, from the mayor to each city councillor, and hopefully then throughout the whole organization within the city, and then outside of the doors of the city hall among all partners, so we can fulfill SDG 17. But to do that was not enough. We needed public accountability. We needed to make sure that the mayor and everyone, every public official, was accountable to, among the citizens of our city. And that's why we created the Cascais 2030 dashboard. It's a portal, a digital portal that's available on the City Hall website. Anyone can visit it. And here we did very, very difficult work for a whole year, finding all of looking at all of the different indicators for each of the SDGs, trying to understand which of these were useful at the local level, not all of them are, and then trying to find the appropriate indicators at the local level that could help us correspond to each of the indicators and metrics within the general SDG program. And that's how we were able to develop a base index for each of the SDGs to understand, looking at 2030, where we are today. And that's how we got, and this is SDG number 3, health quality. And you can see here that we're at 70-something percent, being 100% where we want to be in 2030. And what is important here is that we are being accountable to our citizens, we are being honest, but we're also saying that people are saying, well, we're very close to where we should be in 2030, we're actually doing pretty well. But the question is, if you start to disinvest, if you start to not invest, it can go backwards also. It's not just forward. And this is extremely important. And getting people to do that checklist with our Chief Sustainability Officer on a weekly basis, we are updating that dashboard to make sure that we are constantly on the right direction. And when we develop the budget for each year, the mayor now has a very informative tool to help and understand what we need to do more to be in line with the SDGs. We developed a report which explains the methodology of how we did this, and then we have specific chapters for each of the SDGs. I won't bother you with details. Just to give you a very concrete example, and we looked at good practices that we also share in that report. And for example, one of the metrics in the SDGs is universal healthcare coverage. And what we did to be able to correspond to that was, okay, then let's establish a goal of achieving one family doctor for each citizen in our city. And we have that goal, and we have already planned out, along with the Ministry of Health, a plan to invest in our city so that by 2019, that will be achieved. And hopefully, where we are today at 73% will go higher. We're also sharing good practices, as I said, and on that portal, on that digital portal, any citizen can visit it, read about the information, but they actually can give their own contribution. And that's something we want to do, is to make this a very inclusive process. Because everything we have done now is the base of what will come in the future, which is the most important part. And so you can see here, you have the different tools at the bottom. You have the dashboard I already talked about. You have the checklist I already talked about. Those will help us monitor and evaluate. They'll help us plan and implement. But as I said, it's the beginning. Now we have to rethink all of those indicators, and we possibly have to add more or take some out. And to do that, we have to do that with the community, with the citizens of our city. And so that's why we're going to create, now that we've already launched, the Cascais 2030 local network, in which citizens are going to be called in, not only from NGOs or local institutions, but even private citizens that just want to contribute. They're going to have room to participate, and hopefully this will be an evolving process. And at the end of the day, we'll end up with the outcomes of Cascais 2030, which hopefully will be a strong contribution coming from the city towards achieving the SDGs. Just a last note then on something very specific with the 2 minutes I have left. Back when I was elected, the city, of course, smart cities is always a buzzword, and the city is investing strongly in terms of mobilization, transportation, public transport, using technology to support that. But health was not on that agenda. So we started to look at literature, and Solana and his colleagues back in 2014 published an article where this came out called Smart Health. A lot has been published on this topic since then, and it inspired us to really think that we could do more using technology to address healthcare. And of course, you have examples where in many cities of the world where you can look at local levels of air pollution, or you can actually, with our share bike system, put sensors on those bikes. If they fall down on the freeway, an ambulance can be called right away, and so forth. But what we came to the conclusion was, and what was said previously is so important, if you don't have the basic tools and the basic indicators to work with, that technology is not that useful. And so looking at health, but also education and social services, we developed what we called Smart Health Cascais. We monitor key health and social indicators, and we do it at the zip code level. So we geo-reference those indicators with the collaboration of the different ministries at the national level, but we also had to find local indicators. And through those partnerships, we've developed this tool, and this is something that came out of it, using our local zip codes. And for example, here you can see exactly how many, in the red of those charts, you can see how many citizens still don't have a family doctor, for example. And this is quite impressive, because if you look at it, where you have the highest proportion of citizens without a family doctor is actually the richest part of the city. You would never imagine that if you didn't have the data. Now we can actually work with concrete data and understand certain phenomena. Here's another example. Now we have electronic prescription by physicians. So we're able to get data on actually patients that buy benzodiazepines and antidepressant drugs. And we have this at the zip code level. And we can see here that Parid over there, the biggest circle, is where they consume more of these mental health related drugs. We would never think that. This is actually supposed to be one of the healthiest parts of our city. We probably have mental health issues we have to deal with. We know we have a very senior population there. Now we can actually drill down into what are the causes. What is behind the indicators so we can address them? And instead of dumping money on top of NGOs and asking them just to do something so we look good in the picture, we now can assess them and see on a yearly basis the impact of everything we do in the city. And here's just another example of diabetic patients and hypertensive patients that we can follow through this. And we also can do this actually now with the winter coming. Game of Thrones reference there. We can actually look at flu season shots through this program. And so we improve, hopefully, the health of the population with this. We're more transparent and accountable. We ensure open access. This platform is available to everyone, and it promotes the role of the citizen as an active agent, generating decision support tools, which, of course, for me is something close to my heart, which is generating tools that allow us to develop evidence-based policy making. With this, hopefully, we'll have better health and better impact for all. If we have smarter cities, we'll certainly have smarter health. You're all welcome to Cascais. Thank you very much. Thank you.
And thank you for taking time off from your campaigning, which I know is very important, and you will be getting back to it
voters in the audience.
very shortly. Can we have a couple of questions for Ricardo before we open out the panel? Yes, there's a gentleman over here, and yep, okay, yeah, there's a woman at the back, please. Yeah.
Hi, my name is Elizabeth. I'm from the UC Berkeley School of Information. I was wondering about if you considered any of the privacy concerns. Sorry, the echo's really weird.
Yeah.
About making health data so available on a granular level. Are people able to opt out, for example?
That's a very important question, and of course we had to deal with it. I'm all for open data. I honestly believe that, and I've been advocating that we need institutes that deal with health-specific data, and that we can find an appropriate solution for this, because clearly what we have today is not enough. What we ended up with was in many situations where going very granular at the 7-digit zip code, in certain circumstances, we would end up like with 3 or 4 citizens. In that situation, we ended up only publishing on the online data with, for the 4 zip code, which is much wider area. So it becomes impossible to drill down to who that person is. And we had a very specific example on the social indicators. For example, we have this solidarity complement where we give an extra financing to senior citizens that are in a very vulnerable situation. And we had situations with the 7 zip code level that we would only have 1 or 2. And so we decided only to put the 4 zip code level, which is a greater area within the territory. And that way we hope to protect that kind of privacy. But I think as we go on and as we see data being managed globally and by global institutions and by social networks and whatnot, I honestly think that we have to reconsider the way we are dealing with data. And if we want to move forward, not only in terms of local governance, but even in the health sector, when we talk about personalized medicine and whatnot, we honestly need to find solutions that make sure that that data is accessible, especially for those that are working in these fields. And the truth is, we've put up so many barriers that then we are not able to evolve at the rhythm that we want. And if you ask people, and I agree with you, an opt-out system is probably the best, because the opt-in systems, as the European Union has been pushing for, are not useful. And a very good example of that is when we look at organ donations. The countries that went for the opt-in option have very few organ donations happening, while as countries like our own that have an opt-out system, we're an international reference.
Thank you.
I hope to answer your question.
And I think there was one more at the back. Well, I'll just take it at the back. There's a number of people, just while the mic's up there, but then we'll have a chance when we open it out. Yes.
Hi, Ricardo. Thank you for that. My name is Vera Zlidar. I'm from the U.S. Agency for International Development in Washington, D.C. And it's always inspiring to hear discussions like that. It reminds me that one person really can be a force for good, so thank you. My question to you is, how did you come to embrace this drive to be so data-driven, to embrace open data, and to really use the SDGs as a way to help you govern Cascais. And if you were not a public health person in a previous life, how could we help encourage politicians to pivot in this direction?
I'd have to tell you my life story to answer that question. I won't get it. I know we're short on time, so I won't get into too much detail. In my previous life, I was an infectious diseases physician. And so HIV/AIDS has always been part of my life and as a professional, and data has been so important in dealing with the epidemic, and so inevitably that has influenced everything I do since then. Then when I got into politics and I understood that data was not part of that world and rhetoric was more of the decision-making process, it really frightened me. And I was sitting in the health committee in Parliament, and I was surrounded by lawyers. You never want to be surrounded by lawyers, but there I was. And talking about these issues, sometimes it can be mesmerizing. But and then at the local level, you start to understand if you don't have these kind of tools, it then becomes impossible to put the carrots in the right spot to push us all in the right direction. And I honestly believe that the SDGs are a great excuse, if you want, to get us all in that same direction. I think the MDGs really showed us that if we all focus on the right direction, we might not get everything we want, but at least we'll get closer than if we don't have a clear plan on getting there. And I'll give you just one concrete example of how we're implementing this at my university. We now just have a new project that we're going to launch in November. It's called Let's End Hep C, focused on hepatitis C. And what we're doing now is actually within this dashboard we've developed, we put in all of the different policies that you need to use to eliminate hepatitis C in a region. And then we have a mathematical algorithm that we developed, and it calculates a series of outcomes, including if you're going to eliminate hepatitis C by 2030 with your policies. And what is great is then the part that I really enforced with my political experience was what we call the policy calculator, in which you can change those policies and calculate the outcomes immediately with that same mathematical algorithm. Because politicians need to see impact, not 30 years from now. They need to understand that if they do something today, they can leave a legacy, and that can be something they can show 2 years from now. And that, I think, is a major challenge, and that's why I think these kind of tools are very exciting, even for non-health related politicians to get on board.
Thank you. Thank you. Well, let's just thank the whole panel before we come to the questions. Brilliant. A really brilliant set of presentations, and I think you've unpacked governance really well, and it's in pieces now, and hopefully we can pull it together. And I just want to, I've been sort of writing down some words as you've been talking, and I'm not saying this to pull it together myself, it's just to almost see it in the pieces. I was struck while Jason was talking about the link between health equity and different modes of governance. There's different ways we can do governance, and that might have different health equity outcomes. And that really struck me. And I almost thought then the sort of neoliberal stance would be there's been a market failure somewhere. I mean, you can almost say from a health equity stance there's been a governance failure. There's a governance failure here. Okay, let's go in and have a look at that and sort out there's a governance failure. And also the idea of governance is how you go upstream for health. How do we go upstream? What's the magic upstream? It's governance, Fantastic, the network of city managers, and hearing about that. And in that network now, sort of, maybe this has always been the case, but health leaping out of health delivery of hospital services, and you're talking about walkability, you're talking about wider determinants, and that being a focus, and then the city dashboard and ways of sharing best practice between cities across this network. And let's hope that network grows, and health governance for equity in the network becomes a thing, because that's really important in cities, the city managers. The multiplicity and the conflicts of governance is what I heard, the contradictions in governance, and also then the sort of causality and catalytic interventions, sort of in bouncing around there, but also the importance of reframing and having discussions about reframing, I think, as well. Not just reframing, it's not who reframes, it's how we have the discussion about the frame, and then coming in very strongly with a frame. SDGs are, could be a potential frame here that brings people together, and also that fantastic history of governance going back to Agenda 21, and you mentioned that, our governance hasn't just come out of thin air. Agenda 21 sought to be the bottom-up governance, and now we almost have people joining together around SDGs, possibly, to make the new type of Agenda 21. And transparency was a word that a lot of people have used. I like the way that the smart cities was serving the health, because sometimes when smart cities is mentioned, everything else is meant to serve smart cities. We're all meant to bow down to smart cities, but here smart cities serve very specific and tamed to serve that. And also hearing the important drivers behind why a politician might want to get involved in this, what's in it for politicians. I think that's really important to hear. So we've got a sort of a plethora of different views here, and I'd like your views, either short comment pieces that we just leave there on the table, or questions to the panelists. So open it to you, and thank you for your timekeeping. We've got 20 minutes or so of discussion time now. So yeah, put your hand up. Can we have the gentleman down here who's been waiting a while first, with the hand up down here, yeah. And again, the acoustics, we'll just have one here first. The acoustics are quite difficult, it's quite boomy here. So just, if you can, challenge me as well if I'm not doing this. Speak slowly and clearly, and then we'll hear the question better. Thank you, and just say who you are and where you're from.
Okay, thank you I have a question of Dr. Ricardo. My name is Jong Tae-ka. I'm a master candidate of the South Korea Kyunghyun University. Thank you for your very great, inspired presentation about your presentation, and I have a couple of questions. You suggested the city could be transitioned as the smart city to cover a number of issues about the health and the sustainable development goals of number 3. But when I saw your presentation, I was wondering then, how do you develop the institutional capacity to adopt the number of agendas in not only the healthcare and the sustainable development goals, which relate to a number of other issues like the climate change or the poverty reduction, and even it could bring a number of issues about kind of the collaboration among institutions or the government agencies that could make some kind of silo effect. Then how do you overcome those number of complicated issues? And second is about that, then when you build those ambitious cities that could reflect a number of interested from the healthcare sector to the other number of stakeholders who have an interest about the smart city or the healthcare agenda, then how do you integrate those interests under the agenda? There is the big agenda of sustainable development goals, but how to adapt and reflect their voices in the urban policies. Thank you.
I'm sorry.
Did you catch?
I didn't get the second part.
We didn't get the second part, but let's deal with the first part. Yeah.
Well, very quickly, thank you for the question. Basically, and I think it's a very legitimate question on avoiding the silo effect of this kind of approach. And I think SDGs are very beautifully put together because they try to avoid that. And the way that they look at, if you look at each of the goals within, you can see that it touches in different areas. Right? It's impossible to deal with SDG 3 if you don't look at the social determinants on all of the other determinants to actually solve it. But there is a risk, and I acknowledge that. And I think that that's why we developed the governance tool, putting it within and having a chief sustainability officer that has to have this bird-eye view. having his war room, looking at that data, having the data from each and every SDG up there, and understanding where that data comes from, making sure that when you meet with city councilors around the table, each of which have different areas under their responsibility, and then all of the local agencies that respond to them, making sure that everyone is in sync. And that's a major challenge, and that means that you have to have very strong political leadership. You have to have a mayor at the city level, or whoever runs the city, if it's the city manager, clearly on board, putting this at the top of the agenda, making sure that everyone understands that you're in sync or you're out. And I think that is extremely important, and the buy-in of the city mayor was critical to achieve that point. And now, having a very strong chief sustainability officer, having the governance tools, hopefully, as we go from budget to budget until 2030, will be evolving in the sense of putting institutions to work better together. Because what you have today in most cities is silos. And hopefully SDGs can help them break down the walls.
Thank you. I'm wanting to bring other panelists in on that answer, but David, particularly from not necessarily about the SDGs, but about the city health dashboard, because you might face similar issues, and about how you see the sort of governance around that and people using that dashboard.
Well, the City Health Dashboard is exciting because on the one hand, like the city of Cascais, there are measures that you can have a dialogue with the community to explain your investments. You can have discussion within government, justifying investments internally and how your one program supports another and the common goal. But I think this new project funded by Robert RWJ Foundation with NYU will establish a common set of indicators for these cities so you can actually have comparisons across cities. At the highest level, of course, Cascais is comparable at the SDG level, from what I understood of your presentation. And of course, each community has to tailor to a large extent their indicators at the neighborhood level for neighborhood level interventions. The other point I'd like to pick up on is the city of Cascais is very fortunate to have an enlightened council person who is coming into the job prepared and used to dealing with data and familiar with the health issues and can drive that agenda. It reminds me of the famous mayor of Curitiba, Jaime Lerner, who also came into his job prepared because he was an urban planner working in the city and had worked his way up. But not all cities are so fortunate as to have a prepared mayor, a prepared council person. Often politicians are elected because they're strong rhetoric, strong politicians. So I think the point made here that there is a chief sustainability officer, a professional in the job that in the US most cities are managed by professional appointed city managers who can continue across administrations, who can make long range planning that are not so subject to the political ups and downs of a new mayor and a new administration coming in. I think this is a critical aspect for continuity, for long-term planning, and for good governance and good ethics and anti-corruption and transparency in general. People who are trained, who make a career out of this and have a network and people watching in terms of their ethical behavior from in the US, a state or provincial and national level. I think these are all very important aspects that contribute to good governance.
Thank you. Other panelists want to say something?
Yeah, yes, but. And just to remind you that the SDGs are a global aspiration in which we seek to leave no one behind and no place behind. And for most of the cities in the world, we have no data. We have inadequate data. They are changing incredibly rapidly. We don't have people who are necessarily literate, let alone are graphically literate, to interpret the data. And we may or may not have the data stored for that place and owned by the people who are decision makers. So we have to be extremely cautious which is not to say that we should not be pushing the frontiers of evidence. And I think the more we know, the more we are able to interrogate and to examine the nuances of precisely of what are the drivers, what actually are the cataclysmic kinds of interventions. But we need to be extremely, extremely cautious and to recognize that we have a common urban future. And so until such time as we're able to make that kind of data-based intervention for all places, we stand the risk of making interventions that are extremely nuanced in particular places and unbelievably crude and dysfunctional in other places. And that's not going to get us to 2030.
Yeah, I would also just caution, is this on? Yeah. That we don't over-romanticize quantitative data and indicators because they don't necessarily lead, as I think you really nicely pointed out, to good decisions. We have lots of good data in economics and we make terrible decisions all the time. Even we're irrational in our own decisions. So I think we need to also value different kinds of data, not just quantitative in these processes. And I think you pointed out that, as well as what I really liked about what you're doing is that we need explicit processes and to know who's involved in those difficult, as Sue really pointed out, those conflicts and trade-offs, which are not obvious and not easy to reach consensus just because we have good indicators. So I think we need to think about these relationships,
I'd just like to add that, data is no substitute for citizen engagement. I mean, I think it will help target and direct that kind of engagement, but a city manager or a mayor or chief sustainability officer can't sit in their room and crunch data and come up with the right solutions without, engaging the community at the zip code level, I would say.
Great. Final words from Susan, and then we'll come back out.
But just briefly, in defense of data, and what we really require of data is a set of urban professionals who are able to actually examine what this new and complex data is able to tell us. So we need the intelligence to be able to interpret whatever information we have at our disposal and to understand its strengths as well as its weaknesses.
Thank you. Thank you. Let's have another question. Yes, I think the woman at the back here was earlier on and then to the front. But the back here.
It's Billy Giles Courteye here from RMIT University in Melbourne. I found it really interesting just seeing Ricardo. If I was in Coimbra, I'd be voting for your wife this weekend on the basis that she might be learning from you. So I think anyone from here, you've got my vote. I just can't vote in the election. It seems to me that what's required in cities, and in different places it'll be different in areas, is you need both vertical and horizontal integration of governance. And in different places, everyone will play a different role. So it's interesting in some cities, like David was saying, that local government has the responsibility for public transport, but where I come from in Melbourne, that's a state responsibility, and federal government often gives money to actually facilitate the big rail projects. So everyone has a role. So I think the integration, federal, state, local, because local government won't be able to achieve its full potential unless there's that integration. So that way, but also, as you said, Ricardo, horizontal integration so that we don't get the siloed approaches, so that we do get integrated planning to achieve good outcomes. I suppose my question to you, and I'd put it back to David as well, is this question about accountability, because what you're setting up is an accountability framework which holds government to account on the delivery of the policies that will actually achieve the Sustainable Development Goals, but create health and well-being. And most governments don't want to be so accountable, and I'm curious about the courage of actually doing that. I think as citizens we're encouraging government to be more ambitious, and so that we can, otherwise there's just this sort of mediocre policy that's not going to achieve a good outcome. And I'm sort of curious to know from you about the courage of governments holding themselves to account, and then for David to see what potential that is for local government to take that on, because I think there's got to be more of that, more accountability, and the objective measurement does actually hold one to account.
Yeah, go ahead.
Well,
Did you
I have one thought
Yeah.
stimulated by that question, and that, we're in, ICMA is engaging one particular program is a city designation program, and is funded by the Department of Energy in the United States. And this is to promote solar energy. So a city designation program will assign cities a gold star, a silver star, a bronze star, and will promote them and feature them nationally at all kinds of events. And this kind of competition stimulates cities to get involved, to request the technical assistance that will get them to the next level, that will attract industry because they know it's good for their city, it's good for their residents. And this will hold managers accountable for keeping up. And if they're not keeping up, it'll be quite evident. Why don't we have a bronze star, a silver star, a gold star? So I think many countries around the world have award programs. ICMA has traditionally had an awards program where we feature cities who are best at this or that, citizen engagement, innovation. And I think cities and mayors in particular want to demonstrate that they are achieving results and will be accountable for that. And these performance measures will show where cities are falling behind others, and residents will start asking why.
Okay, thank you. Yeah.
Well, thank you, and following up also on what David said, and thank you for the vote. We'll get the paperwork done afterwards. I have to say that it was a tremendous challenge. I mean, I'm just showing you the end result, right? And if we hadn't pushed the way we did, we probably would have never got the data, because the data was not there. But it also says if we didn't push, we'd never get it. So it's always, a tricky situation to be in. And my first approach was very disastrous, actually, and I'll tell you the bad story behind this. And my first approach was when I got into the office, actually the term was halfway through, because I didn't take the office right away, and I stepped in halfway. And so one of the things I did, and the mayor asked me, listen, we need to look at health and quality of life in a more broader way. We need to rethink our macro strategy. And I said, okay, so I tried to collect all of the projects we were working in the social field, in the health field, and after analyzing all of them, I developed a framework to assess the impact of each of them, so that on an annual basis, instead of spreading out the money, we can actually see what the money is getting for the city and for the citizens. It was hell. I mean, hell broke loose within the city hall. The technicians behind that were not at all collaborative. Even high officials were not wanting to go down that path. I gave up. And I sat down with my team and I said, this is not going to work. And that was a lesson learned. And I said, okay, we need a framework that will help us solve the same issue, but getting everyone on board. And that's where, when SDGs were our magic solution, our magic bullet there. And we started to rethink then, and we got the mayor on board, and then we got the councillors on board, and we started to sell the concept. And there was a buy-in without truly understanding what they were buying into, so to say. But it was an extremely important process, because getting them involved from the very beginning, doing it slowly, not being too direct on responsibility and making sure that whoever is responsible for a bad result has to pay for that, but doing it in a positive way. Saying, no, this is to help us all go together in the same direction. It really transformed the way it was perceived, and that's how we were able to reach the point where everyone feels on board, and we got not only that vertical structure, but that horizontal. I just wanted to say two things also. On the SDG platform, we developed it in a way that it's replicable anywhere. So it's easily, the methodology is quite simple, and hopefully I'm happy to put you in touch with our CSO if you're interested in that. So because that's something we believe that to be able to compare ourselves with other cities is extremely important. And what was mentioned, the importance to tailor it then to whatever your location is extremely important. And the second thing is, what this has already helped us to do is to sometimes understand that there are certain things that are not our responsibility at the city level, as you were mentioning. Some are state level or at the national level. And what we ended up doing was the mayor acknowledged, and I'll give you this example that I mentioned, that we needed more family doctors. We had this issue if we wanted to have universal health coverage. It's the baseline. And we understood that the Ministry of Health would actually get the human resources, was not willing to invest in the new clinics to put those doctors in there. And the city said, it's not our responsibility. We're going to invest 6 million euros. We'll put that there because this is critical for us to achieve all the goals we need to achieve afterwards. And that shows that we were able to go beyond our responsibilities, understanding that that would help us then achieve our goals as a city.
Okay, thank you. Yes?
Reinforce that last point.
Yeah.
I mean, local government, is where the rubber hits the road, where you can see what's working and what's not working, including federal programs. And I think one of the important functions of local government or municipal associations is to be a sounding board for national government and to be able to collect information across cities and inform national government as to whether their policies or regulations are effective or not, and to rationalize the flow of federal dollars to different cities in an analytical way.
Okay. Thanks. I need to draw the session to a close now. Only slightly over time. There was one question I was going to ask, but we'll leave it hanging because we've talked a lot about the public sector here. We've talked about citizens. We've talked about research. But of course, there's a whole cadre of capital investment that builds cities, that transform cities, that slosh around in London and have empty blocks of flats and suck the economy out of other places. So we haven't actually talked about that whole the business sector, the construction sector, and the governance there, and how we engage them to build these healthy cities. So just, let's leave that hanging. We haven't got time for that. But thanks to the panel again, and thanks to all your questions. Thank you.